Hi, I am Mary Hanley and with Elevate Your Health, and I'm here with Dr. Matt Davis with Optimize Health and Davis Orthopedic. And so we're going to be talking today about hormones. But before we really get started, we want to tell a little bit about ourselves and how we came here and why we're doing what we're doing today. So we'll start with you and tell us a little bit about you.
So my background is I'm a physician, I'm an orthopedic surgeon, and for the longest time I've just taken care of people that were suffering with various orthopedic problems. Sometimes it's injuries, sometimes it's just things that kind of wear out over time. And kind of what drew me into hormone health, specifically for women, is I often see the downstream consequences of hormone deficiency in women. With low estrogen, we often see low bone density. And then with low testosterone, we often see loss of muscle mass. And that combination puts people at great risk of falling and breaking a hip. And then that's where I get involved. And so my interest in hormone health is trying to help women prevent some of these problems so that they never have to see me as an orthopedic surgeon.
Yeah, exactly. And I have come to the hormone direction kind of inadvertently as I've gotten older because, I start seeing changes and I see a lot of people doing urine testing and seeing how the hormones are affected in a lot of other areas of the body. I start seeing how downstream that's causing a lot of other issues with, weight gain and things like that that a lot of women are dealing with. So that's
Right.
where I have come to this direction from. Um, so we're just going to kind of talk and we're going to ask each other questions and kind of get to some bottom line answers on some things that we hear a lot of. So one of the things I hear a lot of is why do we want to do injections of hormones and what's the best way to get about like balancing out the hormones? I do a lot of natural directions with a lot of people, especially if they're still producing hormones. And so we do a lot of natural like supplements and things like that. But then there comes a point where that just is not good enough anymore.
Yeah, so one of the things that I think is challenging is that there are different categories that I see that women go through. The normal menstrual cycle, monthly up and down with hormones, that is characteristic of your, reproductive years. Then there's a phase of perimenopause and then menopause. Menopause is when you're no longer making estrogen. That's a little easier to define. Perimenopause is this long window, and it can vary from a few months to a few years, several years for some women. And I think in that period, these natural methods are very helpful to kind of support and stabilize the hormone system so that it functions better and you can kind of even out some of this roller coaster.
Yeah.
When we get to the end where you're no longer producing any estrogen, I don't think there's any amount of supplements that you can take that are going to make your body make something that it's not making anymore. And so that's where we start to talk about hormone replacement therapy or HRT. There's different terminology that gets used. I kind of throw it all in together in one big category. But hormone replacement therapy is where we're no longer expecting your body to make its own anymore. We're just giving it what it used to make so that you don't get all of the symptoms that we see that go along with menopause and the lack of estrogen. So there are a few different ways that we might help women with estrogen replacement therapy. Just from a big picture standpoint, the four methods that I've seen used and I have some experience with all of these is you can do it orally as a pill. You can do it topically, typically as a cream. You can do it as injections, or you can do it as pellets. And there are pros and cons of all of those different approaches. And we kind of talk through what I see as the good and bad of each one of those and why you might choose one method over another.
Yeah. So, like, I know I talk a lot of people about, like, I have a lot of people who do not want to do any of it. Like, they just keep me on the natural path no matter what.
Right.
But then they are seeing other side effects, like with osteoporosis and heart disease and different things like that coming up. So, how do you weigh out the two different directions when you're looking at like helping somebody to understand like what direction they're gonna need to go in because they are very concerned about cancer and all of the things like that.
Right. Well, so everyone's body, everyone's physiology is somewhat unique. And so I don't believe in a one size fits all answer. So I do think you have to look at each person individually and kind of gauge what their health status is currently and what their family history might look like if they are genetically prone to certain conditions. Then we have to take that into consideration. So, from a hormone health standpoint, a couple of the things that I see as beneficial about hormone therapy, obviously bone density and muscle mass. Those are very important to me as an orthopedist, but heart health is a big issue. This is an interesting little bit of trivia that a lot of people aren't aware of. But if you look at heart health or risk factors of heart disease, heart attacks, however you want to define that, if you compare men to women, for the first 50 years of life, women are far healthier than men when it comes to heart health. But after menopause, a woman's risk matches a man's.
Wow.
And so what we can deduce from that is that estrogen is cardioprotective. It provides a protective benefit. And when you lose estrogen, you lose that benefit. And so for that standpoint alone, I mean, if we look at causes of death across the population, heart is one of the leading causes of death for women. And so anything we can do that lowers that risk is worth at least considering. I don't think everybody has to do it, but it's definitely worth talking about. From a cancer standpoint, there's a lot of fear out there about whether or not estrogen contributes to higher risks of breast cancer. A lot of that is from old studies that have been repeated since then and found that that's not really the cause. Estrogen is not associated with an increased risk of breast cancer. We do think that there are some issues related to synthetic progestins, which are common in different forms of estrogen therapy, like especially oral. So a lot of the birth control pills or, Premarin, which is one of the most common hormone therapies, oral versions has a synthetic progestin. So I'm not a fan of those because we do think that that's probably connected at some level with increased cancer risk.
Okay. So that really answers a lot of questions just in that one thing, because that's where everybody's mind goes. Really is the cancer. What about like pellets? Like where do you stand like the pellet thing? Like pellets are not my favorite in any kind of form, just because I've seen a lot of people have to get them and have them taken out, and it's just causing all kinds of adverse effects. So what's your thought?
Yeah, so I think the draw for pellets is that they're convenient. You go into an office, they do a minor procedure in the office, they insert the pellets under the skin, and then you don't have to think about it for 3 months. So there's no pill to take, no cream, no shots, like you just do the pellets. And on paper, that sounds great. And the idea with pellets is that they get slowly released over about 3 to 4 months. And so you get this smooth, steady dose. But that's probably not what happens for everybody. I think different people metabolize these pellets at different rates. And I've seen a lot of people that the first month, right after they've had their pellets inserted, their levels are super high. Like they have a lot of symptoms and side effects that you would say that their levels are too high. In month 2, they feel pretty good because things have kind of come down and they're right where they need to be. In month 3, they start to feel like it's wearing off and they start to lose some of the benefits that they were hoping to get from the therapy. And so then they kind of have to just hold their breath, waiting until it's time for the next round of pellets. And so I see this as kind of this roller coaster up and down. And it's not always pleasant for those people that are riding that roller coaster. The other problem that I see quite often is that these clinics that put in pellets don't always check your blood levels. They just kind of guess at the dose, they put them in, and then they're just like, yep, hopefully that's good. And there are some women that when they get their blood levels checked, if they come see me, first thing I start with is blood work because I want to see where they are. And a lot of these women have sky high testosterone levels Because in addition to the estrogen, a lot of clinics will put testosterone in there too. There's reason that women benefit from testosterone, but the dose that a woman needs is significantly lower than what a man needs. And some of these women, when they get their blood levels checked, their testosterone is way too high. And that can cause a lot of problems. It can cause a lot of side effects.
Oh, yeah.
And so I'm not a fan of the pellets because I don't think it's as reliable. And I think that it makes it tough to dose the individual components separately. Because when you put them in, you're kind of stuck with that dose for 3 months.
Yeah.
And you can change the dose the next time around, but if you don't have number.
And because they're just like throwing it all in there together, like
Well, and I think that's really the sad thing is that I think sometimes people have a bad experience with one particular method, and then they think that it's the
Across the
therapy
board.
in general, and so then they don't want to do it again. And it's not the hormone therapy, it's the way that you did it. And so I don't think you have to just discard it entirely. I think you just have to think about, is there a better way to do this?
Yeah. What about like bioidentical? You know, that to me is probably the easiest, best way, not easiest necessarily, but it's probably the better way of all the choices.
Yep.
So what does that look like?
So bioidentical basically refers to, we're trying to provide your body with something that is exactly the same as what your body naturally makes. The old versions of estrogen therapy, both birth control pills and hormone replacement therapy, a lot of those started off as coming from horses. They would take pregnant horses that had very high levels of estrogen circulating in their bloodstream, and they could purify this. And so it was equine estrogen that people were given. And it worked okay, but it wasn't a perfect match. And so there were some weird things that we saw with that. And then the progesterone, the synthetic progestins are close, but not exactly the same. And we think that causes some issues too. So bioidentical basically just means it's the same kind of estrogen that your body makes, the same kind of progesterone. So chemically, you wouldn't be able to tell the difference between progestin that you got out of a person and the progestin or progesterone that you got from the pharmacy. Like if you looked at them chemically, they're going to be exactly the same. And so that's what most people recommend now is bioidentical. But that's what that refers to.
Okay. One of the things that I've enjoyed doing is starting to do Dutch testing, which we can kind of see how your body's metabolizing all the hormones that are in your body and what that looks like. So it's one good thing that we can kind of see what's the difference between if we're doing the Dutch test or doing just regular labs. What's going to be the better thing for someone to do?
So I think it just depends on what you're dealing with. Estrogen is present in multiple different forms in your body. Estradiol is probably the one that we measure most because that's the most active form, but there are other forms too. And as your body metabolizes this stuff, it changes from one form to another. And a downstream form still has some effect, and it may have a different effect than the estradiol in its original form. And so if we're just trying to check and see if someone is capable of making their own estrogen, whether or not they're in menopause or not, then a blood test to measure the amount of estradiol in their bloodstream is easy to do, and that's a very reliable test to say whether you're in menopause or not. When it comes to like metabolic function and different symptoms that people might be experiencing, I think the Dutch test probably gives you a broader view of, okay, well, you're converting this at a really high rate, and so then you might be having these symptoms or side effects. So you're still making it, but the way that your body is handling it is kind of skewed. And so I think you get different information from those tests. So it's not better or worse. It really depends on what are you trying to figure out which test is going to give you that answer best.
Yes. I use it a lot, especially for women who are wanting to get pregnant and they're having a hard time getting pregnant. Women who are trying to figure out, am I still making some of these hormones or am I not? You know, like how are they really functioning like in a complete capacity? So that has been really helpful to be able to see the full pattern of everything.
Well, and I think the Dutch test is easier because it's a urine test.
Yeah.
And so that's a little easier to get it done. A lot of the blood work that we get done, you have to go either to a doctor's office or go to a lab, and a doctor has to order it, and it's just a little bit more involved.
It's true. So if somebody comes and they're like, I don't know what I'm doing, like what are their first steps? They know that they're kind of in this hormonal state. They don't really know how, they know they don't feel good and normal, but like what are going to be their first steps to like walk them through getting some things done?
Well, so a lot of times when I'm seeing women in the office, this conversation just kind of comes up naturally as I'm talking to them about whatever they're in my office for. And so one of the first things that we kind of talk through is common symptoms. And if they have a lot of these symptoms, then we might want to investigate further. So probably some of the most common symptoms that I see, well, and I kind of categorize these into the three big categories of hormones that we're really talking about in this conversation is estrogen, progesterone, and testosterone. Most women are somewhat aware of the estrogen and progesterone symptoms, even if they don't know like which one is responsible for what.
Just being a woman, you figure it out.
Right. Well, and I think you hear people talking about stuff. So the typical ones for estrogen are going to be hot flashes, night sweats. I see low bone density, which is not really a symptom, but is a consequence of low estrogen. I do actually see a lot of women that complain of joint pain. So shoulder pain, hip pain, sometimes even knee pain. And it's just because their estrogen's low. And once we correct that, then those symptoms go away. So they come to see me because they think it's an orthopedic problem, but it's not. It's a hormone problem. Some of the symptoms that we see with low progesterone are going to be brain fog, difficulty sleeping, sometimes kind of this low grade anxiety, almost like you kind of fixate on things that don't really matter and you can't stop thinking about them, like your brain is just stuck in a loop. And a lot of times that's a progesterone issue. So as we talk through those symptoms, we can kind of figure out, is this something that they're actually dealing with? And then the best way to kind of further investigate that is just simple blood work. So we send them to the lab, get some blood work done, and then we can look at various levels. One of the things that's a little bit tricky with these blood levels is that you have a normal monthly fluctuation. And so depending on where you are in that cycle, you might expect numbers to be high or low. So sometimes we do have to kind of inquire about, okay, when was your last menstrual cycle? When did you get your blood drawn? And kind of figure out, are these the levels that we would expect at that stage, or does that look totally off? When your levels are almost undetectable, which is common, then it doesn't matter where you were in your cycle, because we know you're done, right? And so depending on symptoms and blood work, then we kind of have the conversation about, here's where you are and here's what we can do to help.
So if you are, since we see this a lot, like all the time, so if you're in one of those places where you're kind of like, I feel like I need to start looking into this, I feel like I've got some of these fluctuations, I'm not feeling normal. You may even had some normal labs at some point that kind of sort of look normal-ish.
Well, and this is a sticking point and kind of a pet peeve of mine, is that a lot of women go to their primary care doctor or their gynecologist and they get blood work done, either as a part of an annual physical or they ask about it. They get their blood work done and they get a call or they get a message through the portal that just simply says your blood work is normal.
Yes.
Or there's one woman that I know that she said that they told her blood levels were healthy. What does that mean? Right. Like I want the number. I don't want someone else, because what's normal? I mean, when I'm driving to work down 280, normal speed is like 50 miles an hour, 55 miles an hour. But my teenagers don't think that's normal. They're going 75.
Exactly.
Or, my 15-year-old who's learning how to drive is going 25. So normal it depends on who
I'm very relative.
it depends on who you're asking. And so I don't like it when women get told that your levels are normal or healthy, because that doesn't answer my question of are you making estrogen? Because I know a lot of gynecologists, especially, will tell their 50, 55-year-old woman who has a zero estrogen level that their labs are normal.
Mhm.
Because what they mean by that is that's normal for a
For
woman
your
in
age.
menopause.
Mhm.
But that's not
Is that
normal.
normal?
That means you aren't making
Yeah.
any.
And if you
And
don't
so,
feel good,
yeah. So
then
I
it's
would
helpless.
always tell a woman to ask for the actual numbers. And you can look at the lab report and it will tell you the number, and then over to the side, it usually has a reference range, and you can tell if you are in a normal range or if you are below normal.
Yeah. So we're gonna shift gears just a touch. So men, on the
Mhm.
other side of that, I mean, we have men that get told,
Mhm.
oh, everything looks normal,
Right.
and still they're not.
Yep.
And things are feeling off. So
Yep.
what does that look like from you?
So this is kind of a weird situation too. When we look at the lab report that we get from the lab that gives us the number and then the normal range. The normal range for a man's testosterone is from, depends on the lab because they do the tests a little bit differently, but the most common ones, it ranges from 300 on the low end to 1,000 on the high end.
Crazy.
That is a huge
Crazy.
range.
Mm-hmm.
So if a man was at 850 for, his 20s and 30s and 40s, and then now he drops down to 450, he's not going to feel the same. He's not going to feel energetic or, there's not a lot. You're running with half a tank.
Yeah.
I mean, if you disconnect 4 of the spark plugs in your engine, your car might still run, but it doesn't feel the same.
Exactly.
So when you look at just the lab alone, a primary care doctor might look at that and say, that's normal. 300 is too low,
Mhm.
and you're 450. But when I look at that and I say 450, if you used to be at 850, like you're going to feel terrible.
Mhm.
And so I don't just base it off of that bottom number of the normal range. So for a lot of men, when we boost them back up to the 7, 8, 900 range, they feel like themselves again.
Mhm.
They don't feel normal and energetic at 450. They feel like they're just dragging through the day.
Yeah.
And so we see the same sort of problem with men. They have someone that checks their blood level, but they're not like a hormone specialist. They're just trying to help. And they look at that and they're like, oh yeah, that's normal. No, 450 is not normal for a healthy, active man.
Yeah. Yeah. And I think that's what is more sad because we see a lot of very normal labs. Like probably 90% of the people we see are normal labbed people.
Yep.
And they're still feeling just really yucky all
Right.
the way around. So if you're confused and you've had these normal labs, but you still don't feel good, then look at the link below. You can go in and begin to filter through, decide what you want to do, and give a call to Dr. Matt or to myself, and we'll go through the steps and start getting you feeling better. It's been great spending some time with y'all today, and we'll talk to you later.